So here's our roadmap for this explainer. We're covering 6 key areas: the hidden health crisis, anatomy of an outbreak, what is a syndemic, the web of vulnerability, power and industry hegemony, and finally, rethinking occupational health.
All right, Section 1, the hidden health crisis.
Okay, let's dive into this. It's a pretty wild paradox when you think about it. Here is an industry that is almost entirely reliant on the physical health and performance of its workers. Yet, as the data reveals, it's heavily plagued by preventable disease. Let's look at exactly what the numbers tell us. 34. This is a staggering statistic right out of the research. Chlamydia incidence among adult film performers is 34 times higher than the general Los Angeles County population. When you compare these performers to everyday folks living in the exact same geographic area, the contrast in disease burden is simply astronomical. But, it doesn't stop at chlamydia.
The disparity gets even more alarming when we look at gonorrhea. Adult film industry performers face 64 times more annual occurrences than all inhabitants in the LA region. And get this, it's 18 times more than people in their direct peer group, the 18 to 29-year-olds. So we aren't just looking at a slight occupational hazard here. We are looking at a highly concentrated health crisis.
Now, what's absolutely crucial to understand here is the stark gender disparity in these infection rates. Female actresses bear a huge, disproportionate brunt of this crisis. The data shows they're 27% more likely to have repeat STI infections compared to male actors. And not only that, their median reinfection time is 21 days faster. The research links this directly to female biology and the prolonged physical trauma they endure. Extended participation in unprotected acts frequently leads to chafed or broken skin, which, as you can imagine, makes them vastly more vulnerable to contagion.
Moving on to Section 2, anatomy of an outbreak.
Now, you might be wondering, are these high infection rates just, isolated flukes? The short answer is no. To truly grasp the scale of this, we have to look at the historical context. If we look at a timeline of documented HIV outbreaks, we see major events in 1998, 2004, 2009, and 2010. And this brilliantly illustrates that these are recurring patterns. It proves that these elevated infection rates aren't just a string of bad luck. It's a systemic flaw in how the industry operates, and frankly, fails to protect its workers.
Let's zero in specifically on the details of that highly documented 2004 outbreak. A single, undetected index case, just one male actor, rapidly spread the virus. And why? Because of the industry's standard practice of lacking barrier protection. He had unprotected sex with 13 women, and 3 of them were subsequently infected. That's a 23% infection rate stemming from just one person in a matter of weeks. It perfectly highlights how fragile the whole system is when it lacks active physical barriers to disease.
Okay, Section 3. What is a syndemic? So to really understand the why behind this crisis, we need to look past single diseases and break down a bit of sociological jargon. What exactly is a syndemic? Well, in traditional epidemiology, we mostly look at one disease at a time. But syndemic theory argues that health risks don't just happen in a vacuum. A syndemic is the synergistic interaction of 2 or more co-occurring epidemics that mutually reinforce each other. In plain English, they interact and multiply exponentially. They amplify the overall health risks for a marginalized population way, way beyond what any single disease could ever do on its own.
For adult film actresses, researchers pinpoint a very specific variation called the SAVA syndemic. That stands for substance abuse, violence, and AIDS. We see this brutal convergence of factors that uniquely plague these performers. We're talking high rates of intimate partner violence, histories of childhood sexual abuse, severe psychological distress like depression and PTSD, and substance abuse. All of these factors converge, right? They feed into one another and ultimately skyrocket the performer's vulnerability to HIV and STIs. It's a compounding loop of risk. That brings us to Section 4, the web of vulnerability. So looking below the surface, how do these deeply personal vulnerabilities actually play out day to day? Well, a massive piece of the syndemic puzzle is substance abuse. Research outlines 3 distinct pathways that lead to this among women in the adult film industry. Step 1, some enter the industry already using drugs. Step 2, others develop a habit through the intense, super-insular social networks within the industry itself. And Step 3, many use drugs simply to self-medicate. They're desperately trying to cope with the immense stress, the heavy societal stigma, and the ongoing physical trauma of the work itself. So the absolutely crucial point here is that drugs, things like methamphetamines and cocaine, they aren't just recreational in this context. They are heavily utilized as a coping mechanism. They provide the necessary energy for these long, grueling scenes, they help maintain the extreme weight standards demanded by directors, and they literally numb the physical pain. But ultimately, this self-medication severely compromises their judgment and their immune systems, which directly fuels the cycle of physical and sexual risk.
Section 5. Power and Industry Hegemony. All right, let's zoom out to the macro level. We've talked about the biology and the psychology, but what about the surrounding environment? Now, what's really interesting about this slide is how the eco-social perspective shows us that individual risks, the internal microsystem of biology and behavior, they do not exist independently. They are completely wrapped around and dictated by a massive macrosystem. This includes the legal structures, the sheer lack of occupational regulations, and the immense economic pressure coming from the top. Basically, the macrosystem sets the rules of the game.
To really grasp this dynamic, we use a term called hegemony. This defines the capacity of a powerful group to subjugate a less powerful one and subtly persuade that marginalized group that their lack of power is just natural. It's just the way things are. And this explains exactly why actresses, despite those massive health risks we just went over, feel they simply cannot demand safer working conditions like condom use without facing immediate and devastating repercussions to their careers.
The industry operates on a very strict top-down hierarchy. At the absolute bottom, holding the lowest power, are the actresses and actors, the ones actually taking the physical risks. In the middle, you've got the producers and agents who control access to the work. And right at the top, wielding the most power, are the distributors. They control the money and the market demand. This structure effectively strips any real agency away from the performers on the ground.
Let's move to and see how this builds, because this power imbalance has very stark, real-world consequences. An actress named Deanna stated it incredibly simply. If you use condoms, you don't work. I just want to let that sink in for a second. It highlights the ultimate economic penalty. Because consumers and distributors demand a very specific aesthetic, the people at the bottom of the power hierarchy are forced to sacrifice their biological safety just to keep their livelihoods.
And finally, Section 6, Rethinking Occupational Health. As we step back and look at the whole picture, the research makes a really compelling argument. We have to recognize these systemic failures rather than just blaming individual choices. A critical flaw here is the industry's current health standard. Right now, they rely almost entirely on monthly HIV and STI testing. But here's the thing. Testing isn't prevention. It acts merely as a post-exposure net to catch diseases after they've already been transmitted. It is not an active barrier, like a condom. This policy fundamentally prioritizes consumer demand and corporate production over actual worker protection.
So, what does this all mean? Well, it brings us to the end of our analysis and leaves us with a pretty profound, provocative question. Can we truly hold individuals responsible for occupational health risks when systemic hegemony forces them to choose between their safety and their livelihood? Understanding the syndemic of the adult film industry means recognizing that disease here isn't just about viruses. It is a complex web of trauma, power, and economics all working together. Thank you so much for joining me on this explainer. Keep questioning the systems around you, and we will see you next time.